Are you feeling overwhelmed navigating your long-term care insurance? That's a very common problem, and we work with people all the time that are asking these questions. They might have bought a policy 20 years ago, but they don't look at it, and now they come to me today saying, I hope I can use this long-term care policy. So let me introduce myself. My name is Betsy Miller. I'm actually the owner of a home care company, but I've also worked in the insurance industry 20 years ago, so I can help you navigate your policy. What is long-term care insurance? So a lot of times people are confused on what long-term care insurance is, and this would be a policy that you purchased. It's not part of Medicare, it's not part of Medicaid. You would have purchased it separately on your own. Some common companies would be John Hancock, Bankers Life, something like that. And then with that policy, you're going to get a benefit per day. A common amount might be $100, $150, $200. And there's often a waiting period of 60 to 90 days. And a long-term care policy can be used for in-home care, care in a nursing home, long-term care, and sometimes it can be used for modification in your home, ramps, remodeling a bathroom, things of that nature. When do you know if you qualify for long-term care insurance? A couple rules of thumb would be, number one, activities of daily living. And what that encompasses is, do you need help? Women especially need help getting dressed. Sometimes they have to attach things behind their back. That's difficult. So mainly just getting dressed, bathing, grooming, toileting. Those are all called activities of daily living. And if you need help with 3 or 4 of those, depending on your policy, that would qualify you. Also, dementia qualifies you automatically. So if you have a doctor that has diagnosed you with dementia, you could use that. And for example, maybe a friend with Parkinson's. So for example, I have a friend whose mother has Parkinson's and the beginning stages of dementia. And her husband is an attorney. He's very intelligent, very worldly about the world. But when it came to this policy, he was very nervous about, when should he start using it? Because in their case, her diagnosis could be many, many years. He wasn't sure what to do, how to start it. So I kind of helped him and just kind of gave him reassurance that yes, it's okay to go to your doctor, to get that letter that you need about the Parkinson's or dementia. And there's many ways we can go about it and just, take it one step at a time. So I think that's really, when you're navigating this world, just remember we can just take it one step at a time and to utilize the professionals like myself who are in the industry and around home care that can help you get it started. How to start a claim. So the first thing you're going to want to do, especially if you're dealing with a situation where the person needing the care isn't able to start the claim on their own, is you're going to want to identify, whether it's you or someone else, who is the power of attorney. Because you will need to have either paperwork in hand or the person needing that the policy is written in call the long-term care policy with you, or sometimes I've even done it. I've gone to the family's home and helped them navigate it by being on the phone with them so they don't feel overwhelmed. Through that process, they're going to send you the paperwork, either do it online or in the mail, to add the power of attorney to that policy. So every time you call, they can talk to you. You're able to get the claim started and things of that nature. Number 2, make sure that if you are feeling overwhelmed, that you get somebody to help you, like myself, or, anybody at a long-term care company should be able to help you. Some are probably more knowledgeable than others, but we want to make it easier for you. And we do it all the time, so it's not the first time we're looking at something like that. And you're going to want to make sure that you use a licensed and reputable agency. The long-term care policies or the companies work with agencies that have already been, approved and we're on their list already, so it makes the process a lot easier.
Hi, my name is Courtney Cole, and I'm a client care coordinator for a home health agency. And here's just something that I'd like to share in addition to the things that we spoke about. The only thing that I would add is that stressing that people look into this earlier rather than later on. It's hugely under I feel like it's undervalued as far as insurance goes. A lot of people, they think they're covered. They have life insurance policies, they have, medical insurance, but long-term care is not something that you're thinking about at a young age. It's something, that none of us want to grow old. None of us want to, need these things in our home, but it is highly valuable to look into a policy for this, because these are things that are unexpected that come down the line, and that you think a lot of times that things are covered. They're not. So I think that mostly I would get it out there that people really need to look into having long-term care insurance, period. It's something that you look into, in your early 30s, because I know that seems like a long way off that this is going to happen, but this is a reality that, you're going to pay into it. And it's something that when you need it, you really need it. And, because it's expensive to have things done at home and very, very necessary, and you want to stay in your home. So this is the way that gets done. So getting the word out there about it, I think, is probably something that's the most important thing that I would add, because a lot of people don't even know what this is. They think home care is covered by medical insurance. That's not necessarily the case. So just, bringing it to light that that's something that's needed.
If you'd like to learn more about navigating your long-term care policy, please go to our website, www.homeinstead.com/193.